Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. Today is July the 8th, and I'm here for this week's COVID-19 update. Across the state of Michigan, it's reported there are 66,627 diagnosed cases of COVID-19. We're seeing a rate day over the last week of about 24 cases per million of population per day here statewide, and a positivity rate that has increased from around 2% to about 3% of all the tests statewide coming back positive for COVID-19. And there are 6,003 deaths reported statewide from COVID. We're averaging about 3.1 deaths per day each day over the past week. Here in Kent County, we're currently at 4,493 diagnosed cases. We're seeing an average of about 50 cases per day, and that's about twice as many cases per day as we were seeing a week or two ago. So that's concerning for us. Although we are seeing also an increase in the number of tests being performed each day, our positivity rate is staying largely the same at about 3.7%. So it's higher than most of the rest of the state, but is not increasing as dramatically as elsewhere in the state or around the country. So some mixed messages there. I think it's important for us to know that right now we are in a precarious position. We are seeing cases increase. And we know that we're very vulnerable for a resurgence in cases. We're at 134 deaths right now in Kent County. We're seeing an average of 0.3 deaths per day over the past week. So because of these increased number of cases and the flat to slightly increasing positivity rates, not to mention the fact that so much of the rest of the country is in a state of crisis with a resurgence in COVID-19, the state has moved our 13-county Grand Rapids region up into the high-risk category. And other regions across the state have also been elevated into the next level of risk categorization by the state of Michigan. So that's something to be aware of. Right now, that's not affecting where we stand in our reopening phase, but it could lead to further decisions about reopening or reclosing certain parts of the economy by the governor in the near days. I'm also seeing lots of debate about this lower death rate that we're seeing around the country. Some are interpreting this lower death rate to mean that COVID is less dangerous now than it was back in March or April, or that we now have it under control. And I want to caution you from jumping to those conclusions. I think there are a couple of reasons for this lower death rate that we're seeing right now. Number one is a reason to celebrate, and it's the fact that we now have better treatment for COVID-19. Between therapies like remdesivir, hydroxychloroquine, convalescent plasma therapy, and practical lessons that physicians have learned about things like laying people on their stomach instead of on their back, and how and when to best use ventilators in support of people who are being treated for COVID. I think all of these learned lessons through the past few months are now making it possible for more people to get to a successful recovery. Not to mention, probably the most important factor there is that we have not overrun our hospitals. Because we flattened the curve back in March, in April, in May, our hospitals have not been overwhelmed, and so they've had the time, the attention, the staffing, the resources to give people top-notch care. The second reason why I think we're seeing a lower death rate right now is the fact that death rates lag case rates. So here in Kent County, for instance, we had our peak in cases in early May, and in late May we saw our peak in death rate. Now we're seeing a resurgence in cases. It may take 2, 3, or 4 weeks for us to see the deaths follow. Hopefully that's not the case, but I think we need to be cautious and recognize that that deaths are always going to follow the diagnosis of cases. Notably, the average age of our cases has also dropped. The average age of a case was nearly 80 years old in late April. We're now seeing that our cases are trending much lower in age. Last week, for instance, our average age of our cases was only 30 years old. And we're seeing that people in the 20 to 29 year age bracket are about 23% of all of our cases in total. So we need to recognize that everyone is vulnerable to this infection. And as long as any portion of our community is engaging in high-risk activities, like going to bars and parties, those kind of large social gatherings, that's putting all of us at a higher risk level that makes it possible for this virus to continue to spread. I've also heard the concern or the idea that maybe public health professionals, like myself, are perpetuating this crisis because we somehow want to destroy the economy or we want to take away the rights of other people. Well, I assure you, nothing can be further from the truth. We recognize and we know that a healthy economy is essential for good public health. We also want everyone to be empowered to exercise all of their rights. And when it comes to public health and when it comes to epidemic infectious diseases, that means that we all have to lean in together against this common threat to our national security if we're going to really empower people to have full access to all their rights. So I encourage you to please lean in together, support one another, be positive, be heroic, stay healthy, continue to wear masks, continue to avoid social gatherings, avoid crowds. Do the smart things we've been talking about now for several months. Those things are effective. And if we continue to do that and we stay positive, we can continue to make this virus, this pandemic, not affect our community as tragically as it has affected so many others. That's all for today. Again, I encourage you, stay positive, stay heroic, stay healthy, and I'll talk to you again very soon.